Welcome back to The Blend. It's the holiday season, and with it comes the eating, the traveling, and the stress. It can really take a toll on your health.
Heart attacks and other heart-related issues tend to spike this time of the year. Here to show us how we can stay heart healthy year-round is Dr. Portz, a Healthcare Partners cardiologist. Good morning and welcome back.
Good morning. Thank you. Good to be back.
We all have heard about heart disease. What exactly is it?
It comes in a lot of forms. It's the one we think of the most is that of heart attacks, but it also involves stroke, peripheral vascular disease, hypertension, congestive heart failure. So we deal a lot with all of that. Unfortunately, despite all the advances we've made in modern medicine in treating these diseases, it still remains the leading killer in the United States. And about one out of every 4 deaths in the U.S. can be attributed to heart and vascular disease.
Is it something that's gradual, or it hits you and bam? It's something that you have?
It can be both. A young person who has no symptoms can suddenly have a problem and sudden death. Most of it is gradual. And a lot of the times, I think, with what we've been doing in modern medicine, we're delaying those deaths from 55 till 75. But in the end, ultimately, it's still a cardiac-related death. So.
Well, if it's happening gradual, that means there's symptoms, and probably, hindsight's 20/20. After it is to happen, you can say, well, he was feeling like this. What are those symptoms that we should be looking out for, and what should we do when we have them?
Yeah, many times the symptoms are pretty subtle, and they sneak up on you, and people won't even think that this could be heart-related. So look for any kind of changes. A lot of people tell me, well, Doc, I'm not 50 anymore, I'm 70, but you shouldn't go from 70 to 90 in 1 year, where you're feeling awful. So a lot of those symptoms attribute, well, I'm just getting old. So if there's a sudden change, in the way you feel, you're more fatigued, short of breath, sometimes the pain is very minimal or non-existent at all, go ahead and seek help, get checked out. And of course, the healthy lifestyles always are good to help prevent that.
Let's get into that. So what do you recommend? Obviously, taking care of your health by eating properly, lots of exercise. People can get started right away, really.
Yeah, the biggest thing that would really help the U.S. in heart disease and vascular disease would be prevention, and that's through healthier lifestyles. We push and try to go for exercise, which is very important. I'd love to see and recommend to all my patients find a way to do, 45 minutes or 30 minutes, 4 or 5 days a week of good exercise. And it varies with how you do it, by what kind of limitations you have and how old you are and whatnot. And eating, weight control, and hypertension control. All these are very important to help. Smoking's huge. That's the thing. If we could get that stopped, we'd have a lot less to do.
No question. Which is what you want, ironically.
Yeah.
Yes. I know. Let's talk about the common mistakes when it comes to people's health. I mean, where do some people go about it wrong?
Some people don't seek care. Some people know that, I'm smoking, but I've been smoking 40 years, Doc. I'm not going to quit now. It's just me. Or my blood pressure's been high all my life, and that's just me, but it still beats you up, and it needs treated, and checkups are important.
Yes, speaking of checkups, do you recommend we do it every 6 months, every year and a half, 2?
Well, people that do not have any type of heart disease or vascular disease, follow up with your primary care doc or internist and see them. A lot of the problems can be picked up early. Refer to me or somebody like me, to treat those and get those under control.
Absolutely.
And then constantly working on prevention and getting better lifestyles from the patients.
Now, the holidays are here, these massive dishes of food. They all look delicious. They're fantastic. We're trying to eat right. Is there anything we should avoid, like the plague?
Everything in moderation. I mean, this is a time of year with cookies and candies and cakes and pies and tons of food and parties and stuff. So everything in moderation. You got to live and have some fun. But just because it's all there and there's a lot of it doesn't mean you have to get your fix all at once.
It's so hard not to. But maybe perhaps instead of starving yourself all day for that big meal, then maybe make sure you eat a little bit in between.
Yeah, even before going to your party, have a healthy snack, so you're not so hungry when you get there, and go for all the bad stuff.
Now, I know you oversee the cardiology division over at Healthcare Partners. Tell me why join a medical group rather than have a solo practice, and how the total care model works for your patients.
Well, I had a solo practice that was great for years. I mean, I really enjoyed it, and even though I'm in a group now, I still do the same thing I was doing there. Building this group with Healthcare Partners, we take care of close to maybe 20% of the population here in Las Vegas. it enables me to really be involved with a lot of lives and taking care of these patients, and not just the 20 or 25 a day that I was seeing. So I can affect a lot more people than what I used to just on my own. And we're doing a lot of good things, and hope to continue to do so.
Absolutely. Doctor, it's a pleasure.
Thank you
very
so
much, as always.
Thanks.
Dr. Portz's office is located on West Sunset Boulevard. To learn more about healthcare partners, just call the number or check out the website on your screen. Still ahead in the Morning Blend.